Namaskar. Maharashtra University of Health Science in Mumbai Vedya Sabha, well, professors, our students, to join a detailed, well-studied and informative lecture series on Charak Nirupan. Every day we have different eminent speakers, and our today's speaker is Dr. Vrunda Kadu. Please. पीयूषपाणी सकिरीट कुंडलम चतुर्भुज चारु विशाल नेत्रम स्वरूप जाना नाम सुख शांति दायिनम धन्वंतरी त्वाम शीर्षा नमामः उद्भिद भीषण जलोदर भार भुग्ना शोचाम दशाम उपगता च्युत जीविताशाः तदपाद पंकज रजोमृत दिक्त देहा मर्त्या भवन्ति मकरध्वज तुल्य रूपा। मृत्युपाय व्यक्ति को भी कंचनमय काया देने वाले भगवान धन्वंतरी को नमस्कार करते हुए हम इस आज के सत्र की शुरुआत करते हैं। आज के हमारे स्पीकर है डॉक्टर वृंदा कडू। डॉक्टर वृंदा कडू, शी इज वेरी यंग एंड एनर्जेटिक. शी इज BMS in 1997 she passed, and in MD she did in 2002 from Vidarbh Ayurvedic Mahavidyalaya Amravati in Kai Chikitsa. She is professor and head of department at Bhau Sahib Maulak Ayurvedic College and Research Hospital at Butibori, Nagpur. Her expertise is in Sneha Vivechan, Rakta Mokshan in dermatology, and Snehan Nirobasti in hypertension. She is one of the most favorite speakers of Mumbai Vedya Sabha since very long. And now today's her subject is Grahani Rog, Lakshan, Sampraapti, Chikitsa, Sutra, Vivechan. So over to Dr. Vrunda Kadu, madam, for Grahani Rog, Vivechan. Thank you.
Thank you, sir. Good afternoon. I am audible, sir?
Perfect.
Thank you. Good afternoon, all the dignitaries of Maharashtra University of Health Science, Dr. Shrikant Deshmukh sir, Dr. Aave sir, and dignitaries of Mumbai Vaidya Sabha, Dr. Shamsundar Sharma sir, Dr. Mehta sir, Dr. Taide sir, and all my viewers. I am very grateful for giving me this opportunity for participating in Charak Nirupam series. May I share slide, please?
Sure.
Slides are visible, sir? Slides are visible?
Perfect.
Okay. Thank you, sir. My today's topic
Absolutely.
is Grahani. My today's topic is Grahani. Grahani is the 15th adhyay of Chikitsa Sthan of Charak Samhita. Grahani Chikitsa is one of the most important chapter because most of the diseases originate from the disorders of the digestion. This chapter is described after Arsha Roga because pathophysiology of Arsha influences Agni, and it is before Pandu Roga as Grahani Roga influences Pandu Roga. According to Acharya Charak Agnadhisthana Manasya, According to Acharya Charak Agnadhisthana Manasya Grahanada Grahani Mata, that is Grahani is the chief sthan of Agni, and there is Ashray Bhav within Agni and Pitta. So Grahani is Svasthan of Pachak Pitta. Therefore, Grahani is also called as Pitta Dharakala. All the process of conversion of food into Sharir Bhav Padartha with the help of Agni is carried out in Grahani itself. Agni, that is digestive and metabolic agents, based on their specific functions of conversion of food into biological elements of the body, are classified into 13 types. First, Jataragni is the most important because it is the initiator of digestive process and it strengthens the digestive ability of other 12 Agnis. 5 Bhutagni transforms the Panchabhuti components of Aharas created by Jataragni into different body structures. 7 Dhatvagni, 7 tissue elements, that is 7 Dhatus. Here all about Aharas. Jataragni initiate the first phase of digestion process by conversion of food into nutrient fluid, that is Aharas. This Aharas is further transported into 3 biological substances, Kapha, Pitta and Vat, in 3 stages, Madhuravasthapak, Amlavasthapak and Katuavasthapak respectively. Samanvayu analyze and separates the Prasad and Pitta part. Useful products get absorbed by the Rasayani, that is villi of the intestine, and sent to microchannels, that is Strotas, by van vayu simultaneously to entire body. 5 Bhutagni works on the formation of the anatomical structure of the body from respect to Pancha Mahabhut in the form of microchannels by digesting needful component present in the biofluid. Each gross and subtle part of body is Panchabhutik, but each one is having different proportion of Mahabhut. Excretable waste products are carried out by 3 excretory channels, that is feces, urine and sweat, along with subtissue and subexcreta of the sensory organ. Annam gruhati pachati vivechati munchati cha. All the prakrut karma of Grahani organ is carried out by Samanvayu, Pachak Pitta and Kledakka. By any reason there is dushti occurs in the Grahani organ, ultimately there will be lack in the process of the Sharir Poshan and Grahani Vyadhi occurs. Grahani is Chirkari Vyadhi, that is chronic by nature, so it is included in Ashto Mahagat by Ashtanga Vidayaka. Hetu of Grahani, that is causes abhojanada, that is starvation, leads to increase in vata and in turn Agni-mandya. Starvation and protein malnutrition disturb the normal indigenous gastrointestinal tract and microflora and impairs the host bacterial defense. Both starvation and protein malnutrition increases the level of gram-negative enteric bacteria and decreases the level of lactobacillus and promote the growth of anaerobes that disturb the gut flora. Ati bhojana, that is excessive intake causes provocation of all the dosha and thereby causing Agni-mandya. Protein-rich diet and fat-laden diet takes longer time for emptying the stomach and increases the acidic pH, and therefore whenever such chimes enter into the duodenum, the liver and the pancreas need to increase their secretions of alkali pH. Repeated such dietary habit leads to indigestion. Further decrease of alkali pH causes reduced transit time in small intestine, leading to diarrhea. Ati rukshahar has low protein value. Protein malnutrition leads to disease and decreased enzyme secretions. Asatmya desh, kal, rutu, which dramatically alters the balance of bacteria in the gut. Suppression of the natural urge may have impact on the nervous system and resulting on the hormonal secretions. These factors have a role in the digestion and absorption as may be understood in case of adhovata, that is accumulation of vata in the rectum and pelvis region, and purish vegdharan. Regular urge suppression disturbs the intestinal prokinetic movements. Disturbed prokinesia increases the transit time leading to change in pH, which further has its impact on the electrolyte and enzymatic secretion, leading to reduced digestive power, that is Agni-mandya. Further, Kshuda Vegdharan leads to atrophy of stomach, which further weakens the perception of hunger. It's controlled by the percentage of the stomach that remains empty. Similar to the explanation given by Acharya Charak that excessive fasting leads to diminution of Agni. Trushna Vegdharan leads to reduced fluid balance in the body. Improperly digested food turns into toxic substance called amavish. It is basic cause of the most of the diseases. If amavish associated with any balance dosh or healthy dhatu, they also turn pathogenic. Grahani dosh is an important example of amavish and agni dushti. Arsho atisar grahani vikara. In Madhav Nidan, it is stated that after treating atisar, if there is mandagni and patient is continuing ahitkar ahar vihar sevan, then there is a huge chance of developing grahani vyadhi. For explaining this, Madhav Nidankar stated that atisare nivritte api. That means Agni-mandya is the main reason for arsha, atisar and grahani. So these three diseases are interdependent as their hetu is Agni-mandya. Am I audible, sir? Sampraapti. This is the flow diagram. Due to ahitkar ahar vihar during already existing Agni-mandya for longer duration, grahani dosh could be formed. Because of dushit grahani and improper digestion, food transfers into vidagdha avastha. Because of shuktapak, that is amlapak of food, Grahani is not able to its routine work and ultimately Grahani Vyadhi occurs. Samanya Lakshan. Sa Dushto Bahusho means digestion of food is hampered in Grahani Vyadhi, so undigested food is evacuated with stool. In Apakvavastha, stool is sandra, sam, foul, and painful. And when there is some digestion process occur, then stool becomes somewhat of pakwa consistency. So muhurbadha, muhurdrava or pakvam wa sarujam puti is the cardinal symptom of Grahani Vyadhi, or we can call it as a Vyadhi Pratyanic Lakshan. When mala is in pakvavastha, then mala pravrutti remains baddha. And when mala is in apakvavastha, that is amayukta, then mala pravrutti remains drava and durgandhit. Pakvavastha and apakvavastha of mala pravrutis totally depend on the ahar matra and swarup, that is food quality and quantity and status of agni at that time. According to Madhu Koshkar, Muhurbadha is due to provocated vata and Muhurdrava is due to provocated pitta. But I think Muhurbadha and Muhurdrava means patient suffers alternate Malabadhata and Dravamal Pravruti for some days. It also depends on the Agni Dushti and Dushti of Grahani organ. When Dushti of Grahani organ is in progressive condition, then patient experiences repetitive Muhurbadha and Muhurdrava Malapravrutti. And ultimately patient suffers only Dravamal Pravrutti. When the Grahani organ becomes very durbal. This symptom is present in the COVID-19 also. In Grahani Vyadhi, there is a more quantity of mal as compared to frequency of Mala Pravrutti. Therefore, Mala Pravrutti is also described as a Sanchayacha Upavishyate. Means there is already accumulation of mal in the rectum and then the process of Mala Pravrutti occurs. Here, another significant symptom is that frequency of Mala Pravrutti is more occurs in the morning as compared to the afternoon and night. In common symptoms, patient experiences aruchi, asyavarasya, bhram, chardi, amlodgar. Overall, whole digestion process get hampered in the Grahani Vyadhi. Due to lack of yogya aharas, utpatti of saptadhatu also get hampered. Ultimately, patients experiences dorbalya and bharakshay. Besides this, patient also suffer pain in the umbilical region, so stomatitis due to ayogya aharas. There is padashot, that is bilateral edema in later stage. Due to Tivra Agrimandya, patient can also feel that he is suffering from several diseases. Now, some other clinical features. Peripheral neuropathy due to vitamin B12 and thiamine deficiency. Dermatitis due to deficiency of vitamin A, zinc, and essential fatty acids. Night blindness and xerophthalmia due to vitamin A malabsorption. Bleeding due to vitamin K malabsorption and hypoproteinemia. Anemia, impaired absorption of iron, folate, and vitamin B12. Amenorrhea and decreased libido due to protein depletion and decreased calories. Tetany paresthesia due to calcium, magnesium malabsorption. Glossitis and stomatitis due to deficiency of iron, vitamin B12, folate, and vitamin A. Variation in digestion as per the night cycle, day-night cycle. Pratarashe tvajirine api. If morning eaten food is undigested and still if anyone taking its evening food, it may not be more repetitive since in the daytime, because all the strota, that is channels, are dilated and heart is in active condition, similar to the lotus which blossoms with the sunrise. During daytime, exercise and other physical and mental activities cause the heart to pump very properly to prevent the genesis of the clade, that is excessive moisture in the various dhatus. There are mainly 4 types of Grahani. First is symptoms of Vataj Grahani. Tasyanya pachate dukkham means food is not easily digested and get fermented. Roughness of skin, dryness of throat and mouth, craving for the food and thirst is increased. Visuchika, chest pain, weakness, craving for all shudders with reduced mental strength. This is the special symptom of Vataj Grahani. Patient feels abdominal discomfort just after eating food and feeling adman, that is distension of abdomen during and completion of digestion. Timir, that is blurred vision, result in vitamin A malabsorption and anemia. Tinnitus is a symptom also found in Pandu, which is observed due to malabsorption of essential elements like vitamin B12. Pain in the flanks, thighs, pelvis, cervical area occurs due to calcium and vitamin D malabsorption. Vrudapida is the chest discomfort which may be a resultant of anemia, but most probably due to gastroesophageal reflux disease. Malabsorption may be for single entity, may lead to weakness that is very severe. Mood disorders are observed due to depletion of essential vitamins, minerals, and other elements. Electrolyte differences creates confusion, which may be the cause of mano-avsad. Now, symptoms of the Pittaj Grahani. So, Ajirna, Nila Pitabham. The stool have undigested food particles having either bluish to yellowish in color, loose and watery. The erection have foul smell, sour taste, and there is burning sensation in the cardiac region, and that is retrosternal and in the throat. Anorexia and thirst are the symptoms of the Pittaj Grahani. Ushna Tikshna Guna of Pitta triggers the inflammatory response of the irritating intestinal mucosa. Indigestion causes depletion of the beneficial gut bacteria and thus breakdown in the balance between the protective and the harmful intestinal bacteria, leads to chronic infection or inflammation. Inflammatory bowel disease need to consideration as Pittaj Grahani. Exogenous factors triggers inflammatory response that the mucosal immune system failed to control. With mild inflammation, the mucosa erythematous, and in severe inflammation, the mucosa becomes hemorrhagic, edematous, and ulcerated. Loose motion, that is dravamal pravrutti, are mainly due to excessive secretion of bile juice, that is dravaguna pitta. Excessive secretion may lead due to excessive formation of bile in liver and decreased absorption of bile in the intestine. Symptoms of Kafaj Grahani. Tasyanya pachati dukkham, halasa, means food is digested with difficulty, nausea, vomiting, and anorexia. Feeling of coated mouth and sweet taste, cough, increased tendency to speed, the penis, that is nasal discharge, feeling a heaviness in the chest and abdomen. Patient does not feel enthusiastic, and stool are mixed with undigested food and mucus. It is heavy, although patient is not emaciated, still he feels weakness and laziness. In this type, due to Guru Guna, stool sinks in the water in Niram Avastha also. Because of improper dhatu portion, patient feels weakness, but in this Kafash type, because of Jaliya Ansh, patient feels edema, that is showed, so patient does not feel krushata. Sannipataj Grahani. Sannipataj Grahani by simultaneous vitation of the Vata, Pitta and Kapha. In such condition, etiological factors, symptoms and signs are of all the three doshas appear. It is more severe in nature. Grahani may some relation with the COVID-19 also. Along with fever, cough, breathlessness, diarrhea, vomiting, nausea, abdominal pain, and gastrointestinal bleeding are also the symptoms of COVID-19. Virus that causes COVID-19 can enter the digestive system through cell surface receptor for enzyme called angiotensin converting enzyme 2. Receptor for this enzyme are 100 times more common in the gastrointestinal tract than the respiratory system. Those who are having irritable bowel syndrome and or any other intestinal problem increases the risk of developing COVID-19. Patient suffers diarrhea with no fever is also susceptible for COVID-19. Patient has very severe weakness, confusion, that is mano-avsad, and these symptoms are also found in the Vataj Grahani. Sangrahani. This Sangrahani is described in Madhav Nidan, though it is not found in the Charak Samhita, Shushruta Samhita and Vagbhat Samhita. But in Yog Ratnakar, Bhav Prakash, Vangasen, Sangrahani is described as a special type. Patient, it could be a chronic stage of Sannipataj Grahani. Patient suffers antrapujan, laziness, weakness, Agni Mandya, backache, watery, some mucoid stool is present. All these symptoms can occur daily or after 15 days or 1 month. These symptoms are more prominent at daytime. It is difficult to diagnose and kashtasadhya and chronic in nature. Its origin is Samavayu. Ghati Yantra Grahani. I think this Ghati Yantra Grahani is also described in Madhav Nidan. It is also a stage of Sanipatash Grahani. In Ghati Yantra Grahani, patient suffers extreme weakness, pain in the rib cage after sleeping, bubbling sound is present in the abdomen, and constipation is present. Now, Sampraapti of Atyagni. Narekshine Kaphe Pittam Kupitam. Person having diminished kapha, aggravated pitta, and associated vata leads to increase in the ushma of Agni, resulting in enhancing the capacity of power of Agni. After digestion of food, the increased Agni starts digesting rakta, etc. dhatus also. Consequently, patient becomes weak and death may be occur due to this disease. The patient feel better on consuming food, but it feels worn out along with the blackouts when the food is digested. Morbid thirst, dyspnea, burning sensation, fainting, etc. are observed in the disease caused by the Atyagni. Now, differential diagnosis. Firstly, Grahani is Chirkari Vyadhi, Atisar is Ashukari Vyadhi, Pravahika is Chirkari Vyadhi, Visuchika is Ashukari Vyadhi. In Grahani, Atisar and in Visuchika, there is no need of Pravahan during Malatyak, but in Pravahika, Sapravahan is always present. In Grahani, no blood is found. In Atisar, blood may be found sometimes. In Pravahika, blood is found in the stool. And in Visuchika, occluded blood is found. In Grahani and Atisar, sometimes Amamal Pravrutti is found, but in Pravahika, there is always Amamal Pravrutti. In Visuchika, Am may be present in the stool. Examination of the feces. Majyatatma means Samamal sinks into the water due to its Gurutva, that is heaviness of arm, whereas Pakwa, that is Niramal, floats over the water. For this, provided stool consistency is not watery and not very compact, and if not vitiated by the Shitagul. Patient could be evaluated for arm dosh, whether Samta or Niramta is present or not, and then appropriately treated with Pachana. Chitraka Gutika is very useful for digestion of arm and stimulation of the Agni also. Sadhya Sadhatva. According to Madhav Nidan, due to growing age, Grahani organ Dushti can be corrected in children, so it is Sadhya in children. And opposite to this, in old age or degenerative stage, Grahani Dushti or Agni Dushti cannot be corrected, so it is Asadhya in old age. In young stage, if repeated Ahitkar Ahar Vihar Sevan is continued, then it is Krucha Sadhya in nature. Chikitsa. First, woman of Utkleshit Dosh. Grahanima Ashritam Dosham. When dosha are located in the Grahani and are associated with the incomplete digested food, excessive salivation, body ache, burning sensation, anorexia, heaviness is felt by the patient, which are the symptoms of the Utkleshit dosha. In such condition, woman with warm water or decoction of Madanfar Pippari and Sarshap should be administered. Treatment, Chikitsa of the lean dosha. Leenam Pakvashayastam. If arm is in Anutklishta condition and present in the Pakvashay, then Sanstran with Dipaniya Dravya should be administered. If arm get absorbed along with the Rasadhatu and circulated throughout the body, then Langhan, Pachan and Shodhan therapy should be administered. Panchakoladi Shritam and Peya. Vishuddha Amashayasmai. After cleansing of Amashaya, liquid gruel of rice, that is Peya, fortified with the Panchakola drug should be administered. It is light and easy to digest the food along with the Dipaniya Drava. Jnatva Paripakvam. In patients with Vataj Grahani, after asserting of Ama is digested, medicated ghee starting with very minimum quantity prepared with the Dipaniya drug should be administered. Niruha Basti. Kinchit sandukshite. As stimulation of Agni is observed, and still if patient finds difficulty in passing the stool, urine and flatus, then in such condition, every 2 or 3 days Niruha Basti should be administered after proper Sneha Abhyanga and Svedana. In earlier presentation, as Dr. Avoy sir has explained the role of Basti Chikitsa, and from this slide we can find out the perfect gut-brain relation. According to Acharya Charak, Basti Chikitsa is not only remove the provocated Vata dosha but also pacifies the Pitta dosha and Kapha dosha also. As we all know, Vayu controls the circulatory system and nervous system. So Basti Chikitsa is very effective in stimulating sensory and the motor nerve fibers. Vivechan Chikitsa. Tata Eranda Telena. After Niruha, Srashti dosh should be cleaned with the purgative drugs like Eranda Tel, that is castor oil, or Tilva Grut mixed with the Ksha. Anuvasan Basti. Ruksham Shuddham Rukshashayam. After Shodhana of intestine, if Rukshata and Baddhata are seen, then Anuvasan Basti with the tail fortified with the Deepaniya Dravya having Vata elevating action may be administered. Niruddham cha Viriktim cha. After appropriate administration of Niruha Basti, Vivechan Chikitsa and Anuvasan Basti, light diet should be taken daily and ghee should be taken repeatedly. Grut. Dashmuladya Grut, Trushanadya Grut, Panchamuladya Grut. All these three Grut are help in the digestion and increase the strength of the Agni and cures the colicky pain, gulma, udar, asthma and cough. It also pacifies Vata and Kapha. Tail Siddhi with above medicine may be used for Abhyanga, that is massage also. In such condition, in conditions such as Kapha Avrutta Vata, that is Vata occluded by Kapha, Sam Kapha and Vata aggravated due to Kapha, then give the above churna for digestion and to stimulate the Agni. The medicine is known as Panchamuladya Grutam, Grutam Churnam. Pachana of Am. Nagar Ativishta Musta. Shunthi Ativisha Musta decoction helps in Pachana of Am. Kalka of above these dravya with warm water also does Am Pachana. Devdaru Vacha Musta. Soak the powder of Devdaru Vacha Musta Nagar Ativisha Haritaki in Varuni, that is fermented liquid from palm trees like dates, and with Anupan of warm water or Dadim Swaras. It is very effective in colicky pain along with the mucus and undigested food in stool. For Pitta Kafaj Grahani, Abhaya Pippali Moolam, decoction of Haritaki, Pippali Mool, Vacha, Katuk Rohini, Patha, seeds of Kutaj, Chitra, Vishwabhejak, that is Shunki Churna. Churna of above content should be administered with the warm water. It is very useful in colicky pain associated with the Pitta Kafaj dominant Grahani. Marichadi Churna is very useful in Vata dominant Grahani and anorexia. It is to be taken with vegetable preparations such as soups, food, and raga for cure of the cough, indigestion, anorexia, anemia, and abdominal pain. 5 types of Yavagu. Chavyatvakat Pippali. Make a paste of Chavyatvak, Pippali, Dhataki, Trikatu, Chitra, Bilva, Patha, Shalmali, Gaja Pippali, Shilajit, Ajajit. Each taken in quantity equal of butter, that is about 6 grams. Fry it in ghee and prepare Yavagu by adding curd or Dadim Swaras. It is very effective in all types of Atisara, Grahani, Gulma, Arsha and Pliharav. Qualities and benefits of buttermilk. Takram tu Grahani doshe. Buttermilk due to its Dipan and Grahi quality. It increases the appetite and digestive power and absorbs the fluid from the stool. And easy to digest action is very useful in Grahani dosha. It is Madhur in Vipak, therefore it reduces Pitta, and due to Kashai taste and Ushnavirya, hot potency, Vikasi and Rukshagun, it is useful in the Kapha dominated disorders. And due to Madhur and Amla Ras, Sandragun, it reduces the Vata. Buttermilk is very useful in all types of Udar Vikar, Arsha Vikar and Grahani Vikar. Takrarishta. Yavanna malike pathya. Take Yavani, Amlaki, Haritaki, Marich in 3 pul, that is 144 gram, and Panchalavan 1 pul together, and add buttermilk to it and ferment it. A sour taste is obtained. This preparation is called as Takrarishta. That stimulates the digestive power and relieves gulma, arsha, krumi, prameha, and udarro. Pittash Grahani Chikitsa. Swasthanagatam Utklistam Agni. If Agnimanda is due to Utklishta Pitta, that ready to come out Pitta in its own place, then in such situation, Vivechan or Vamana should be administered for the removal of the Pitta. Chandanadya Gruta, Nagaradya Gruta to be taken with honey. Tandulodak is very effective in the patient suffering of Pittash Grahani, who are having a symptoms like blood in stool, arsha, dysentery, and pain in the anal area. Kiratadi Churna, Bhunimbadi Churna with good and cold water is also advised. Loha Parpati and Kutaj Parpati are extremely used in the Pittash Grahani. Kafaj Grahani Chikitsa. Grahanyas Leshma Dushtaya. In Kafaj Grahani, first administer the Vamana and then increases the Agni, that is digestive power, with the help of Katu, Amla, Lavan, Kshar, and Tiktaras. Palash, Chauvya, Chitrak, Matulinga, Haritaki, Pippali, Pippali Mul, Patha, Dhanyak, Nagar are taken in the 12 grams and decoction is prepared in the 768 ml of water and reduce 1/4. This decoction is administered as Paniya or Yavadu. Madhukasav, Durlabhasav, Mulasav, Pindasav are very useful in the prevention of the genesis of the disease. Even healthy person may take this preparation for the period of 1 month and take anactus and liquid diet. Madhvarishta, Kutajarishta stimulates the power of the digestion and regulates the Fisham Agni. It cures the Kafaj Grahani and impures Bala, complexion, and Agni. Grahani Kapat Ras, Kanak Sundar Ras is very useful in the Kafaj Grahani. Diet after Shodhana. Avidahi Viranyasya means after proper Shodhana diet which does not cause burning sensation and easy to digest and mix with the bitter dravya should be taken. Soups of animals of arid zone, that is Jangal Desh, soup of cereals such as Mugdayush and Khand should be given. Pomegranate having sour taste should be taken along with the ghee and Dipaniya dravya and Grahi dravya. With the help of Grut fortified with the Dripaniya dravya and Tiktarasatmak dravya, Agni will be increased. Kshara Gruta. Bida Kalotha Lavanam Sarjikayam. Bid Lavan, Kalotha Lavan, Sarjikshar, Yavakshar, Saptala, Kanthakari, Chitrakari burn together and later on mix in water and filter 7 times. This kshar is mixed with the equal quantity of Grut and Sneha Siddhi is done. The kshar is indicated for increasing digestive power. Kshara Bhutika, Chaturtha Kshar, Pancham Kshar and are the best stimulant of the Agni. Once the medicine is digested, Mounseras and a sweet diet of milk should be administered. Tridoshas Grahani Chikitsa. Tridoshe Vidhi Vividya. In Tridoshas Grahani, Panchakarma should be carried out as per the predominance of the dosha. Various ghee, kshar, asav, arishta preparation are useful in the stimulation of the Agni. Snehanam, Swedanam, Shuddhi Langanam. Snehan, Swedan, Shodhan, Langhan, Dipan, various powder preparation of Lavan, Kshar, Madhvarishta, Surasav, various Takra preparation, Dipaniya growth are prescribed in the Grahani dosha patient. Chikitsa according to aggravation of the dosha. In Kafash Grahani, if there is excess of sputum, then Ruksha, that is Ananaktas, Dipan, Tikta Rasatmak drugs should be administered. If patient is weak with excessive cough, then alternate and repeated Ruksha and Snigdha therapy should be administered. After complete examination and Pachana of arm, ghee with Dipaniya Dravya should be administered. If Pitta is aggravated, then Dipaniya, Tikta and Madhur Rasatmak drug should be administered. If Vata is aggravated, then Dipaniya Dravya along with Sneha, Lavan and Amla drugs should be administered. Sneha with Dipaniya Dravya is best for the stimulating of Agni. If patient find difficulty in evacuation of the stool due to hardness, then salt mixed gruth should be administered between the food. If excessive intake of sneha is a cause for Agni Mandya, then Churna preparation, Asav, Arishta preparations are very beneficial. If analaria is added by the unformed stool, then Taila, Sura, Asav preparation should be administered. If Udavarta, that is misperistalsis, is responsible for suppression of Agni, then Niruha and Sneha Basti should be administered. If Agnimanda taken place due to chronic diseases, then Gruta is the best for Agnidipan. If fasting is the cause of Agnimanda, then Evago with Gruta should be taken. If Agnimanda has been chronic and patient become weak, then soup of prasaha animals, that is animals who snatch their food with amlaras, is advised. These meat soup are light, very light, having penetrating, hot and purifying quality that stimulates the Agni. Management of Atyagni. Payasam Krushara Snigdam Paishtikam. Payas means milk pudding. Krushara means thick gruel prepared with rice and lentils. Snigdha and Snigdha, that is anaktas. Paistik means flour paste. Various jaggery products are very useful in the Atyagni. Roasted meat of sheep may be given to pacify the Atyagni. Now, role of Agni. Factors affecting the Agni. Fasting or overeating does not stimulate the Agni. Proper intake of Sneha followed by the eating proper food preparations as well as appropriate use of various churna, sura, asav along with the proper medication as per the condition enhances the power of Agni similar to the environmental fire which remains stable for long duration. Eating wholesome diet in appropriate quantity after previous eaten food is digested help in maintaining the good health for longer duration. A person should work out so Agni Vriddhi takes place without disturbing the balance of the dhatus. Such Agni digests the food and maintains the health and nourishment. And it promotes the longevity and increases the strength. Improper dietary habits. Pathya Pathya Himeka. Taking wholesome and unwholesome food together in diet is known as samashan. Vishamashan is defined as taking food either in excess quantity or very little quantity and also if taken before or after appropriate time. Adhyashan is having food even though previously eaten food is not yet digested. All above the three are the death for causes for the death and give rise to serious disorder. These are some yogas now which certainly increases our digestive power if we will do it regularly. Regularity and swaniyantran on towards ahitkar ahar vihar plays an important role in good digestion. Effect on immunity. Prayatna, efforts, urja, energy, kaf, bala, strength are the role played by the vat, pitta and kapha in building the immunity. When the exogenous and the endogenous factor vitiated the dosha, which when associated with the ama produce either local or a systematic disorder. Tridosha plays an important role in impairing immunity and depending on the dominance of the particular dosha, they are classified into Vatash, Pittash and Kaphash disorder. Now I want to share one case study. A female patient of 36 years complained mild abdominal pain, alternate constipation and diarrhea, nausea, weakness from 3 weeks. After Strotas Parikshan and Mala Parikshan, this treatment is given. Langhan and Pachan, Chikitsa for 5 days. That is Mugdha Yush or Peya only after stimulation of hunger. And then Shunthi Ativisha Musta decoction for Pachana, 15 ml Pratasayam. Then Panchamuladya Grutpan, 20 ml for 5 days is given. Then Vivechan Chikitsa by Erenda Sneha is given after Sneha Abhyanga and Svedan. And then Kutaj Parpati 125 mg with shunti churna 3 gram is given. As told by Suchitra ma'am that rasa aushadhi should not be given alone. Chandanadya grut from the minimum dose of 2 ml pratasayam to maximum dose 15 ml pratasayam is given. Now with proper yoga, dinacharya and patya, patient has no abdominal discomfort and complaint. Thank you.
Thank you very much, madam. Well, friends, we had very elaborated description over Grahani, the most complicated one to treat, the most complicated for the physician to understand. So the madam has very precisely described about the differentiation between Grahani, Visuchika, Atisar and Pravahika. So now it becomes very easy for you to diagnose the Grahani and you to treat it very patiently. And she has described many ways to treat it with the medication and with all the karmas. So thank you very much, Vrunda madam, for your excellent elaborated description over Grahani. Thank you very much. I request Dr. Vinayak Taide sir to give his remarks on this. Dr. Taide sir.
Okay. वृंदा मैडम ने ग्रहणी, लक्षण, चिकित्सा, संप्राप्ति के बारे में जो वर्णन किया है बहुत ही बढ़िया, बहुत अच्छी स्लाइड्स थी। एक बात छूट गई है, वो बात ये थी कि संग्रहणी किसे कहना चाहिए। जहां संग्रह होता है उसको संग्रहणी कहते हैं। बग ये संग्रहणी में संग्रह कब होता है? दिवा प्रकोपो भवति रात्रो शांति व्रजेश्च। दिवा प्रकोपो भवति रात्रो शांति व्रजेश्च। ब्राह्म मुहूर्त में मल के वेग आ जाते हैं। 2 बजे के बाद मल के वेग कम हो जाते हैं और सुबह फिर से ब्राह्म मुहूर्त में वेग शुरू हो जाते हैं। 2 बजे से सुबह 5 बजे तक संग्रह होता है और ब्राह्म मुहूर्त से लेकर 2 बजे तक मल के वेग आ जाते हैं। तो ये जो संग्रह काल जो है, ये संग्रह काल में मल का वेग ज्यादा आना या मल का संग्रह होना, इस प्रकार की जो स्थिति रहती है, इस प्रकार की स्थिति में एक बात ध्यान में रखते हैं कि इसमें जब मल प्रवृत्ति होती है ब्राह्म मुहूर्त से उठने के बाद 6 बजे होती है, 6:30 बजे होती है, 7 बजे होती है, 7:30 बजे होती है, 8 बजे होती है, 10 बजे तक मल प्रवृत्ति होती रहती है। अब इस प्रकार के अवस्था में जो अन्न लिया जाता है वो पचन होता ही नहीं है। जब पचन होता नहीं है तब मल प्रवृत्ति के बाद पेशेंट को तृष्णा, ग्लानि, दौर्बल्य, भ्रम, तिमिर दर्शन, इस प्रकार के लक्षणों की अभिव्यक्ति होती है। और उस प्रकार के अवस्था में पेशेंट बोलता है मल प्रवृत्ति से करने के बाद मुझको भी खाने के लिए चाहिए। दौर्बल्यता, क्योंकि जो सारभूत अंश जो रहते हैं वो मल के द्वारा निकल जाते हैं, इसीलिए मॉडर्न वाले इसको स्प्रू के अंतर्गत उसका समावेश करते हैं। इस प्रकार की स्थिति में जब यह स्थिति निर्माण होती है, उस प्रकार की स्थिति में पंचामृत परपटी का प्रयोग वर्धमान योग में अगर हम देते हैं तो उसका रिजल्ट मैं खुद इस प्रकार की जब अवस्था निर्माण होती है, उस प्रकार के अवस्था में 41 डेज तक पंचामृत परपटी का प्रयोग तक्र के साथ करता हूं। पंचामृत परपटी, भर्जित चूरक चूर्ण, एक एक पूरी सुबह शाम खाने के पहले तर्क के साथ देने से पहले 3 वीक में लक्षण जितने जल्दी कम होते नहीं है। पहले 3 वीक में लक्षण कम होते नहीं, लेकिन 3 वीक के बाद तुरंत लक्षण कम होना शुरू हो जाते हैं। 5वें वीक में और 6ठे वीक में मल प्रवृत्ति जो रहती है वो एकदम निराम होती है, बनकर आती है। यानी अन्नम गृणति पचति विवेचति यानी विमुंचति। इसमें जो अन्नम गृणति विमुंचति पचति और विवेचति कार्य बराबर होता नहीं था। पंचामृत परपटी के द्वारा इस प्रकार का कार्य संपन्न हो जाता है। परिणामतः यह 15 दिन के बाद, 1 महीने के बाद, 8 दिन के बाद जो रोग बार बार होता है उसमें उपशय मिल जाता है, होता नहीं है। इसलिए पंचामृत परपटी का प्रयोग इस गृहिणी रोग में करना चाहिए। विजया परपटी का प्रयोग करते हैं, ताम्र परपटी का प्रयोग करते हैं, लोह परपटी का प्रयोग करते हैं, कुटिज परपटी का प्रयोग करते हैं। तो इस प्रकार की जो परपटी जो है यह अन्नम गृणति पचति विवेचति और विमुंचति और मुहूर्तबद्धम मुहूर्द्रवम, इस प्रकार का जो लक्षण अभिव्यक्त होता है जिसमें समान वायु की कर्मतः विकृति रहती है और अपान वायु की कर्मतः वृद्धि होती है। तो इस प्रकार की विकृति को नष्ट करने के लिए इस प्रकार के योगों का प्रयोग करना रुग्ण के लिए हितकारक होता है। आज मैडम ने बहुत ही अच्छा जो अपना डिस्क्रिप्शन दे दिया है, हाँ बहुत अच्छा लगा। हमारे स्टूडेंट्स के लिए, हमारे चिकित्सा के लिए बहुत ही उपयोगी होगा। इसके साथ मैं मेरे वाणी को विराम देता हूँ। थैंक यू
वेरी मच ताड़े सर। बहुत ही बढ़िया आपने भी मैडम के अनुसंधान में जो परपटी प्रयोग बताया। सो आई रिक्वेस्ट एवरीबॉडी कि कृपया परपटी अपने आप से, अपने हाथ से बनाएं टू मेक इट वेरी इजी। आपके पास थोड़ी सी छोटी बड़ी मशीनरी होगी तो पंचामृत परपटी में पारद, गंधक, लोह, अभ्रक और ताम्र समान मात्रा में ले लीजिए। पहले कज्जली बना लीजिए, फिर उसमें भस्म मिक्स कर लीजिए। सर ने दूसरा बताया विजय परपटी, ये बहुत कम लोग यूज करते हैं। विजय परपटी में भी पारद, गंधक, स्वर्ण भस्म, रजत भस्म, वैक्रांत भस्म और मुक्ता पिष्टि होती है कि जो रक्तातिसार में और रक्तज ग्रहणी में या पित्तज ग्रहणी में काफी अच्छा काम करती है। थैंक यू वेरी मच ताइडे सर, यू आर ऑलवेज अ मास्टर ऑफ एवरीबॉडी। आई रिक्वेस्ट डॉक्टर श्याम सुंदर शर्मा सर टू गिव हिज रिमार्क्स।
Thank you, Dr. Vinod Mehta. In fact, Dr. Vrunda Kadu explained everything, including Lakshan, Sampraapti, Chikitsa, Sutra, and the treatment. She explained woman Vivechan, use of Kshar, everything. It was up to the mark. And she included COVID-19 also, and this brain and gut and brain connection also. That is good thing that we can explain according to modern science also. How does it is related with gut and brain. So this is a good thing. So I congratulate Dr. Vrunda Kadu for her presentation. She presented one case study also. So it's a good thing. And Dr. Taide, I would like to ask you one thing about this ulcerative colitis.
Ulcerative colitis can be correlated with Crohn's disease. Crohn's disease में बेसिकली अल्सरेशन फॉर्म हो जाता है और उसके बाद सरक्त मल प्रवृत्ति हो जाती है और उस प्रकार की जो अवस्था रहती है, बेसिकली इस प्रकार की स्थिति में जिसमें 100% रिजल्ट मिलेगा, ऐसा जो फॉर्मुलेशन जो है जो मैं खुद यूज करता हूँ, जो मल के द्वारा जो ब्लीडिंग होता है, ये ब्लीडिंग स्टॉप करने के लिए पहले ट्रीटमेंट करना पड़ता है। बाद में जो स्वेलिंग आ गया है, परफोरेशन हो गया है, उसके लिए ट्रीटमेंट करना पड़ता है। और उस प्रकार की अवस्था में चंद्रकला रस, कहरवा पिष्टी और मूलबद्ध रस का प्रयोग करना चाहिए। चंद्रकला रस, कहरवा पिष्टी और मूलबद्ध रस जो है ये दिन में 3 बार सुबह शाम मधु एवं तंडुलोदक के देने के बाद 3 दिन के अंदर इसमें ब्लीडिंग स्टॉप हो जाता है। उसके बाद हम पिच्छा बस्ती का प्रयोग करेंगे और पिच्छा बस्ती का प्रयोग करने से सामता स्वेलिंग कम हो जाएगी। अगर अल्सर कुछ बचे हुए हैं तो उसी के लिए मधुयष्टि तेल का भी हम प्रयोग, उसकी बस्ती हम दे सकते हैं। तो ये क्रॉस डिसीज जो है, ये क्रॉस डिसीज जो है, इसको हम अल्सरेटिव कोलाइटिस के साथ क्या हम कोरिलेट करते हैं, जिसमें हमें बहुत बार कार्शत्व मिलता है, वेट रिडक्शन हो जाता है क्योंकि रक्त प्रवृत्ति ज्यादा हो जाती है, और उस प्रकार के अवस्था में अगर थोड़ा भी मल कड़क हो जाता है तो वहां ब्लीडिंग होने की संभावना ज्यादा रहती है। इसलिए इस प्रकार के अवस्था में पिच्छा बस्ती का प्रयोग, कलरस कैरा पिष्टी का प्रयोग, यष्टिमुदु तेल की बस्ती का प्रयोग, यह लाभप्रद होता है।
धन्यवाद डॉक्टर।
थैंक यू वेरी मच। थैंक यू सर। आई जस्ट लाइक टू ऐड, क्योंकि Crohn's disease is very common in US country. We have many patients from there and they are very much scared about the plasmas and properties which we like to give them. So the best is Bilwadi Churna. It's most easy to make, and it's I think it's a 3-dosha shamak. So you can do Bilwadi Churna in Crohn's disease, and even any type of Atisar or Grahani, Bilwadi Churna is definitely helpful. Well, thank you very much everybody.
आजकल जो केसेज आते हैं ना, IBS बड़ी पॉपुलर डिजीज हुई है।
Exactly, yes, because of the life, sedentary life, और उसी के कंटिन्यूटी में आपका कल का सब्जेक्ट आ रहा है सर, क्षार लवण, सब नमकीन बहुत खाते हैं। कोरोना में सबने घर पे बैठ के बहुत नमकीन खाया है, पकौड़ियां उड़ाई है बारिश की सीजन में। So Grahani is definitely one of the complication of this. So thank you very much friends on behalf of Maharashtra University of Health Science and Mumbai Vidyasabha.
एक मिनट मैं
जी सर। अरे सॉरी प्रदीप सर, you are there.
Yes,
please.
तो ग्रहणी और मन स्वास्थ्य का भी बहुत रिलेशन है, तो इसके हिसाब से थोड़ा सा एक कोई मैं ताइड सर से रिक्वेस्ट करूंगा कि
इरिटेबल बाउल सिंड्रोम जो है,
हाँ,
इरिटेबल बाउल सिंड्रोम जिसमें वैगस नर्व स्टिमुलेट ज्यादा हो जाती है, चिंता वायो धातुक्षयात, चिंता वायो धातुक्षयात, जिस प्रकार के चिंता के वेग आ जाते हैं, चिंता हो जाती है, स्ट्रेस आ जाता है, पेशेंट मलप्रवृत्ति करने के लिए जाता है, स्ट्रेस आता है। तो ये जो है इसको हम इरिटेबल आईबीएस जो रहता है, ये आईबीएस जो है बेसिकली मानसिक निदानों के द्वारा होता है, और उसी के लिए ये जो मानसिक निदान निर्माण हो गए, हेतुमूलक चिकित्सा करना जरूरी होता है। और हेतुमूलक चिकित्सा तो हमें बेसिकली आईबीएस में शिरोधारा देनी चाहिए। शिरोधारा हम दे देंगे तो निश्चित ही आईबीएस के पेशेंट का जो वैगस नर्व स्टिमुलेशन ज्यादा हो जाता है, पेशेंट के इंटेस्टाइन की पेरिस्टाल्टिक मूवमेंट ज्यादा बढ़ जाती है, मल के वेग ज्यादा आ जाते हैं और उसमें उपशय ज्यादा मिल जाता है। इसके ऊपर मित्तल हॉस्पिटल में मेरे ही अंडर थीसिस हो चुका है। थैंक यू सर।
मेरा एक अनुभव है आवड़े सर, आईबीएस में, कि जो कुटज है, बिल्व है, इस तरह की जो औषधियां देते हैं उनके साथ में मैं सर्पगंधा का उपयोग करता हूँ, और उनको मानसिक रूप से उससे अच्छा लगता है, और मैं उनको काउंसलिंग भी करता हूँ और धीरे धीरे वो ठीक होते हैं सर। ऐसा मेरा अनुभव।
तो ये लक्षण तो हाँ, ग्रहणी चिकित्सा के लिए तो अपने वो ड्रग देकर हम चिकित्सा कर रहे हैं, ये बात ठीक है। इसके साथ जो मानस चिकित्सा जैसे उसको बोलते हैं हम, योग है, मेडिटेशन है, वो भी, उसका भी बहुत सा ज्यादा उसमें इफेक्ट हो सकता है, क्योंकि जब तक क्योंकि उसका कॉज ही पूरा कहाँ पे है, साइकोसोमेटिक है। तो जब तक वो हम मन पर चिकित्सा नहीं करेंगे तब तक वो सिर्फ ड्रग देने से साथ साथ वो ऐसा इंटीग्रेटिव अप्रोच होना चाहिए, योग थेरेपी होना चाहिए और उसके साथ आयुर्वेद भी होना चाहिए, तो उसका और भी उसमें इफेक्ट हो सकता है। Thank you very much, madam, for sparing your valuable time for our lecture series.
It was an excellent presentation, madam.
Thank you very much. Yes, on behalf of Maharashtra University of Health Science and Mumbai Vidyasabha, we are very much thankful to our today's speaker, Dr. Vrunda Kadu, for his excellent presentation on Grahani, a very chronic and very difficult to cure a disease. And we cordially invite you tomorrow, same time at 3 o'clock, with another very famous speaker, Dr. Shyam Sundar Sharma, and her subject is very common nowadays. Everybody is in touch with it. Kshara Lavan Ati Sevan Janya Vyadhi Varnan.
Dr. Vinod, please correct it. It is not her.
So I request everybody tomorrow, let all of us observe salt-free day and to hear Dr. Shyam Sundar Sharma on Kshara Lavan Ati Sevan Janya Vyadhi Varnan. Thank you very much, everybody. Thank you, Dr. Vrunda.
Thank you, everyone.
Thank you very much, Dr. Taide sir, Dr. Shyamsundar Sharma, Dr. Pradeep Awale sir.
Yes.
Hope to see you
Thank you.
tomorrow
Thank
at 3 o'clock. Thank you very much. Thank you.
Thank you, everyone.